Hi guys, welcome to What in the Nursing, where we discuss topics that make you question why you went to nursing school. So today we'll be discussing AKI, also known as acute kidney injury. We will go through the definition, the causes, the phases, and signs and symptoms of AKI. So what is AKI? Acute kidney injury is the sudden loss of kidney function over hours to days, causing a buildup of waste, fluids, and electrolytes in the body. Let's think of our kidneys as a washing machine that filters blood and keeps things clean. If this machine breaks down, it won't work as expected, and it will result to the buildup of waste and excessive water in the body. And what are the causes of AKI? We have three main causes of AKI. We have prerenal, intrarenal, and postrenal causes of AKI. In the prerenal causes of AKI, this decreased perfusion to the kidney. Think of the damage is usually before the kidney. In the case of our machine, the machine does not get enough water supply, meaning the kidneys are not getting enough blood. What can be the reason for this? We can either have dehydration, GI losses such as severe nausea and vomiting, cardiac damages in heart failure, burns, obstruction, and hemorrhage. Intrarenal AKI, there is damage inside the kidney as a result of prolonged ischemia, meaning our washing machine filters are broken. Can cause intrarenal AKI. We have nephrotoxic drugs, e.g. aminoglycosides. Examples of aminoglycosides are vancomycin and gentamicin. We also have chemo drugs, NSAIDs, and contrast dye. Infection can also be another cause of intrarenal AKI. In postrenal AKI, there is blockage of the urinary tract and the damage usually occurs after the kidney. In the case of our washing machine, the draining pipes have an issue, meaning they are blocked. What are the causes of postrenal AKI? We can have tumors, benign prostatic hyperplasia, renal calculi, blood clots, and neurological disorders such as stroke. Next, let's discuss the phases of AKI. An easy way to remember them is by saying our own dirty room. Our for onset, on for oliguric, dirty for diuretic, and room for recovery. During the onset phase, triggering event occurs that results to kidney injury. The signs and symptoms might be mild or unnoticeable. During the oliguric phase, there will be a decrease in the urine output that is less than 400 ml per day, and also an increase in the BUN and creatinine levels, since these are our waste products. So what can you do as a nurse during this oliguric phase? Monitor input output. If a patient does not have a catheter, you can catheterize them to make it easier. You should also monitor their weight. Limit protein intake, since urea is a product of protein breakdown. Limit fluid intake to prevent fluid overload use. And also monitor for hyperkalemia. So in the diuretic phase, the urine output starts to increase around 3 to 5 liters per day. The kidneys start to recover, but the patient is at risk of dehydration and hypokalemia. So what can you do as a nurse during this phase? 1. Monitor input output. 2. Monitor their daily weights, and also monitor the signs and symptoms of dehydration and hypokalemia. The last phase of AKI is recovery. Here, normal kidney function gradually returns, and it can take weeks to months. What are the signs and symptoms of acute kidney injury? We have decreased urine output, fatigue and lethargy, nausea and vomiting, confusion due to uremia, fluid overload, and also electrolyte imbalance. So thank you guys for watching the video. If you liked it, make sure to comment, like, and subscribe, and also share it with your friends. Thank you. I'll see you next time. Bye bye.